welcome everybody. We're going to take just a minute for everybody to join us. Okay, so welcome to the AOBTA Lunch and Learn seminar. I want to just give you a heads up about how we do this. The series is being given once a month, and we have people lined up for the next 3 or 4 months, so hopefully we will be continuing with that. Just to let you know that the way that we're working this webinar, you are in listen mode only, so we do not see you or hear you, but please just take a second to look for your chat box on the bottom, because any questions that you have, you can enter there. It would also be nice if you could enter your name and where you're from to start off with, so we can get an idea of who's here. Also, you can submit questions as we go through, and there'll be a couple of places where we will be answering questions. And Matthew Swigert is here, our Director of Communications, and he's going to be monitoring the chat and feeding the questions to our presenter. This seminar will be recorded, and the recording will be made available to you and anyone who is not able to attend in person. And it'll be on the event listing in the website, of the AOBTA website. So I want to introduce my dear friend, Pamela Ellen Ferguson, who is a diplomate of ABT from NCC AOM. She's an AOBTA certified instructor, licensed massage therapist, and former AOBTA director of COSP. And I want to say she's former a lot of things with AOBTA. She's been serving with the organization pretty much since the beginning. She's the author of several books and is the ABT columnist for the monthly Acupuncture Today series, where you can find past articles on ethics. And she's just helped us to make Acupuncture Today online available to our members, so you can check in with that. So Pam's Lunch and Learn webinar will focus on the ethics of transforming your practice during a pandemic. So Pam, take it away.
Thank you very much, Devious, and greetings everybody. It's been lovely to see all the names popping on the screen as to who's here. And let me just say that I do want us to get a very hearty discussion going today. So I'm not just going to be a monologue. I think, can I have the first menu, the first slide? There we go. So what we're going to do is we're going to race through a whole bunch of tips. I've been spending the last couple of weeks interviewing a very wide range of ABTs and also colleagues in acupuncture as well, just to find out how everybody is tuning into different forms of telehealth. We don't use the term telemedicine for, obviously for legal reasons, and also how they're coping. And I would say, you know, everybody's trying to juggle family requirements, maybe loss of income, sudden loss of jobs, having to totally transform their houses into studios, schoolrooms, restaurants, and so on. And I quote my dear friend Isabel Anglica here in Austin, who's doing everything and goes out every day with her pups just to rejuvenate. And I also quote Ninny as well, Ninny Melvin, who's a wonderful teacher, shiatsu in Northampton, Massachusetts. And she has shared so much with me about her teaching and also her clinical practice online, in terms of encouraging people to go out, immerse themselves in nature as a rejuvenation, as a replenishment and a refreshment, and not to overload time on the computer and on the internet. But in order to hear that, of course, they have to be online. So everybody is coming up with different ways that they themselves are rejuvenating and energizing themselves, and how they are a resource, a double resource for their clients, if they're connecting with them through Zoom, through FaceTime, or sometimes just through the telephone. And it's been very heartwarming to hear about the flexibility of payment at this time. Those who can afford to pay and are in jobs have no problem at all paying for the usual hourly rate. And then to get a whole bunch of advice, acupoint tips, nutrition, herbal advice, exercises and stretching. And a lot of our colleagues are in fact demonstrating all of the above, or sending little video clips, or giving little sort of snippets of advice about different pressure points, when to access them and why, you know, for insomnia or stress and so on. So everybody's being amazingly, amazingly imaginative and very compassionate at this time. I don't know if all of you read the New York Times on last Sunday, but there was a huge article on the walloping impact of PTSD on first responders and people in the different hospitals, the surgeons and nurses, the respiratory therapists and so on, and how a lot of them are falling apart when they just get a little word of compassion or something. And I think this is where our work is going to be paramount. I don't know how many of you are actually working with any medics or first responders or EMTs or people at the front line, but later on, this, I'm sure, is going to be a large part of our work. But and it's going to be interesting to hear from all of you. So please keep feeding me with information and with tips about this as I continue to write about it. It was also wonderful this week to talk to a lot of people. I used to be on the faculty of the AOMA, the Graduate School of Integrative Medicine here in Austin. And I've interviewed a bunch of colleagues about the way they've transformed their teaching online, and also it's the only COSP school in Texas, and they've also opened up a food pantry for students, and we're all chipping in, all of us. So it would be very interesting to hear from other COSP schools or other schools as to how you're helping clients and students who really are up against it in all kinds of ways, maybe job loss or having problems with kids trying to do homeschooling and so on. And another thing, those people who are continuing their ABT training online as teachers have this tremendous intimacy with their students because they're suddenly in their homes and so on, and trying to teach while kids are fighting in the background or somebody's hollering out, "Mom, Dad, can I find such and such?" And how people are having to juggle all of the above in a way that is graceful, effective, and also very practical. But I think everybody's being extremely patient. I know all the teachers are being very patient, and those students who don't have excellent access to internet are being contacted by phone. So there's a lot of communication going on that is, I think, very endearing and very encouraging, especially amongst our AOBTA members. I know, can we have the second slide there? The second menu? Great. And what has been interesting actually is to find out that people are being extremely flexible. Maybe they'll do a 10-minute Zoom here or a 5-minute FaceTime here, or in extreme cases, they're making themselves available, a 5-minute phone call, a 10-minute phone call, and it's keeping a lot of people alive and balanced. And I even heard from one colleague who received a phone call from somebody in a food line, and this person just needed to talk and to share, and just needed to offload in a way they found they couldn't for their families because they needed to be the anchor. So I think really at this time in history, don't underestimate the fact that you're all playing an abundance of roles and carrying out an abundance of tasks that, heavens, none of us were taught how to do this during our own training, but I'm sure those of you who are teaching actively are helping your students to use this as a tremendous learning experience. Because this pandemic isn't just going to end, we're not just going to flip over the page, but we're having to learn a whole new way of living. And I think it's incumbent upon everybody to be kind to themselves, not to neglect the absolute basics of chi movements during the morning, even if it's 5 minutes here, 10 minutes there, meditation and inner focus, so that you don't become fragmented by the very fragmented situation in which we're all living at the moment. And also, when we get to, I think we can flip over to the next menu. But before I get into the checklist for reopening, and this was very helpful for me, in fact, to attend an NCC AOM town hall, as they call it, last week, and to hear about all the pieces of advice about when you can legally reopen your clinic, and of course doing it on a very limited way. But before we get into that, I'm very happy to answer any questions or hear your thoughts before we get into the 10-point checklist for reopening. So who is checking the comment board? Do we have any questions thus far or any comments?
Let's see. Just a bunch of names and locations so far. Nobody's commented yet. Maybe this would be a nice time to call for comments. If anybody, if you'd do you have a specific question you'd like to ask people about, Pam?
Yes, of course. So please go ahead. As I say, I do want this to be very much of a dialogue or a triple log. And I'm here to be
hearing that it's all good info so far. Thank you. That's one comment.
Great, excellent. So no questions thus far.
I would like to just chime in that I'm leading online Qigong classes now, and they're fabulous. And there is that intimacy piece that's really interesting, because I'm like doing it from my own home, and I'm seeing into the homes of my students. Yeah. Yeah. And yes,
Matthew, how has that changed the dynamic of you as, interacting with your students? Are you learning a lot more about them and being a lot more flexible in the way you teach them?
I think I'm learning more about myself because I'm the one on screen. And just learning to manage my energy in that way. I'm not having a lot of interaction with students personally. Diane Haynes has chimed in that she's been holding Qigong classes and Zen Meridian stretch classes.
Excellent.
Yeah.
Excellent. I might ask everybody has anyone reopened their private practice, their in-person practice?
We can come to that later.
We have?
Yeah, I think we can come to that later, Devious. Diane had a question, but I only saw a little bit of it. Can Diane chip in again? There was a question there, but I only saw one little segment.
I'm not sure. Of it. Wayne, do we have the capability of opening microphones for participants?
Or she can go into the chat box.
Yeah.
Yes. So Diane, if she would like, she has, we can hear her if she wants to.
You can hear me now?
Yes,
Hi,
indeed.
Diane.
I'm not always the fastest typist, so. I guess I was going to ask about the reopening.
Oh, okay.
I suppose every state is different, so we're going to talk about that later. But I wanted to agree with Matthew in the beginning, it was really interesting doing things online. And I am doing one Facebook Live video for a yoga studio. And that was kind of bizarre, just being in the big room and, talking to myself and looking at the screen while I didn't even know who was on watching. And then the other, when I did it at home, which is fabulous, it's with Zoom. So I'm seeing some of my clients and I'm feeling they're using that as this way to connect. And at the end, we have like 5 to 10 minutes of question and answer.
Yeah.
Yeah.
And that's been like so helpful for them. They feel really, really connected and they feel anxious when they can't get online.
Yeah.
They get, well,
Excellent.
that's been a big learning. And Matthew, I agree. Like I'm sometimes watching myself, looking at them. It's, and I never have more than seems 4, maybe 5, sometimes 2. The most I ever had was about 8.
And Diane, may I ask, do you do it at the same time every week? The reason why I ask that is that one of my acupuncture buddies here in Austin has a sort of a tea and talk session every Wednesday morning where anybody can chime in, and it's absolutely free for a whole hour, but it's at a regular time every Wednesday.
Yeah.
And her clients and students and friends and everybody just chips in and they talk about nutrition. She takes a 5-element theme, or she takes a particular theme. And then those who want to follow up with a session, you know, to talk about nutrition or have a herbal consult can do that afterwards or the next day. But she says how valuable it is, and that people just share and brainstorm and, you know, talk about what they're going through. But as I say, it's at a regular time every week. And I was wondering, Diane, if your Qigong class is at a regular time every week.
Yes, on Monday and Fridays at 9:30, or Qigong and Wednesdays at 10, or the Zen Meridian stretches, which that tends to be the talk time because, you know, we do things really slow, and I have a lot of clients with replacement knees and hips, so I have to modify a lot of the movements for them and or the positions, right? So it's been really helpful because at the end, so I've been doing that, so it's kind of a little more interactive, that class, and it's less formal following a, you know, Qigong session, let's say.
Oh, that's absolutely great. Absolutely great.
But I love your idea, Pam. I really wrote down that whole, I want to make it more of a, I think that was so great. Just have that, like, okay, everybody can chat for 20 minutes or whatever. So I might do that, like half and half. We do some movement and then
Great.
I like that.
Now, the important thing here, Diane, and that you know, was stressed to me because of HIPAA. If you know, 10 or 15 or however many people are on the chat with you or on the Zoom with you, you may need to get some release emails going because some of them might be sharing some health challenges and so on, and not realizing that 8 other people or 10 other people or maybe their employer can hear it. So be very mindful in the sort of group brainstorming that you are HIPAA compliant. And I think just a quick email from everybody. Hey guys, it's lovely if you can all share very openly and very freely during this session, but we just need to fall in line here with HIPAA. I'm just going to send each one of you a quick email and just send it back to me. Does that make sense?
Mm-hmm.
Yes, totally. It really does. I as it expanded over the last month, instead of just being 3 or 4 people who knew each other, I have had people bringing in people from their circles. Like, oh, can I bring my sister or my neighbor or my plumber? One person was like, my plumber saw it in the background.
I love it. Absolutely perfect, Diane. I love it. You know, you bring in the whole household.
There were a couple other comments here.
Yes.
Rosemary checked in to say that it was helpful to get the perspective about the vastness of scope, how we're reaching out, and the value that we bring. So thank you for that, Rosemary. And Susan Atwood has suggested she's teaching movement classes on Zoom, which has gone well, but she's anxious to discuss the logistics of reopening. And another, Valerie checks in that a friend has gone to her chiro and his acupuncturist as well. So there are some clinics that are still open. Yep, students all on screen together from Nini. Nini says all her students are on screen together, so it's not only her. And then
that's nice.
Ain checks in to say that she's finally taken time in her life to throw myself all into my Qigong practice. including teaching more of these exercises to my remote clients. My Qigong practice is absolutely keeping me grounded, connected, balanced, and well.
Fabulous to hear. And I should say, I was talking to, again, a colleague who teaches both Qigong and also Tai Chi. And she was saying, because of the form of Qigong, how much easier it is to teach through Zoom than Tai Chi, where you have to leap about and twist and turn and all the rest of it. And I was saying, well, probably you have to reach a stage where you have 2 cameras. You know, you have to get pretty sophisticated. So I'm interested. I love hearing that so many people are sharing their Qigong wisdom and skills and movement, and from all points of view, and especially for people maybe who are homebound or have any other kind of physical challenges and so on. It's absolutely ideal, especially if people can follow in their chairs.
I teach a regular Qigong class with a senior citizen group for 5
Perfect.
years. And we moved it online. I'm having 20 senior citizens show up for my Qigong class 3 times a week.
Beautiful. I love to hear
And they tell me, you're keeping us alive.
Yeah, exactly, Matthew.
Yeah.
Absolutely perfect. I love to hear it. And are they in a group setting or in a retirement center, or are they scattered all over?
They're in a retirement community. They're all homeowners.
Oh, they're all
independently,
homeowners.
living independently and living in their own shelter at
I
place.
see. So they all come in independently then. They're not 6 feet apart in a big room or anything.
No,
No.
they're all.
But I love to hear this. I love to hear this. And I'm sure they're bringing in their buddies as well.
And then just to move on a little bit here, sorry, Leanne has asked about telehealth and how to keep legal medical records. How folks are doing with keeping legal medical records during this time. So I know you're going to address that.
Thank you very much, Leanne. This is a very good point. First of all, put everything online. Have your intake forms, your Q&As, and so on and so forth. Get them to answer all these questions online to minimize the time that you actually do one-on-one with them when you eventually get into clinic, so that you're in fact setting up a whole bunch of new records. And you can either create a special file in your computer or just print everything out and keep files and so on. But definitely all your intake form, and you can also do maybe a Q&A by phone. Now, if you're doing telehealth and it's a new client, get all this information kind of up front before you actually do the telehealth. And the important thing is here to keep very much within the confinements of how you've been trained. Don't start sort of shooting off in tangents and, you know, playing psychotherapist or anything like that, but be very practical and very extremely clear about the advice that you're giving them for a particular problem, or just for stress release, insomnia, say GI problems that people might be going through, or people that want to murder their kids because they're jumping up and down behind, or whatever. That, you know, you come through with little packages of advice, or even promise to send them emails with tips, and demonstrate the points that you're advising them to access. Actually demonstrate those online. Like for stress, P6 and P8 are just, for me, 2 of the most golden points in the body. And get them to do this along with you in the telehealth sessions, and explain about the meridians if they don't know about them, and do some stretching and movement, or tune them into a Qigong class before they even do the telehealth session. I think this is very important for new clients. Clients who've been coming to you for years or for months, you can talk in shorthand. And again, some of it will be ongoing advice in terms of what you've been seeing them for years or months. It might be a chronic problem, or like chronic migraines or something like that. You can ask them about their current health history. Are they experiencing more migraines as a result of what's going on? What are they doing to defragmentize themselves so that they're not picking up on all these fragmented energies around? And this is where the Qigong plays a huge role. So you kind of pick up the thread of what you've been treating them for weeks or months or whatever, any chronic problems. And you're just expanding that to take into consideration the impact on their lives of what's going on now and the impact on their migraines or headaches or GI problems or whatever, so that they know that you're very mindful of what they are going through personally, and especially with job loss or spouse loss. And another thing that I think is crucially important at the moment, have a list of resources. And you can send this to all your clients or even mention it in your group sessions and so on, especially spouse abuse, family abuse, child abuse, and so on. Hotlines apparently are bursting all over the country. So make sure you have the 1-800 or 877 number for your local hotlines for abuse issues and so on, and youth issues too. Youth stress, because often these phone numbers change, and make a phone call to your local shelters or your local havens and places of escape for people who are going through abusive households, and have a chat to them, and if you can get through, so that you feel comfortable in terms of referring people. Now, this is where texting has become very, very important, because as somebody said, if you're cramped in a tiny apartment with an abusive partner, you're not going to run to the phone and call the police or call the hotlines. You're going to text, or you'll go into the restroom and do your texting very quietly. So texting is becoming crucially important at times like this. But don't underestimate the effect on families, especially those that are cramped together and unable to do much moving about, and on the elevation of statistics of abuse issues in families. And believe me, if you've been working with a kid or a husband or a wife or an elderly person or a person with disabilities who has been going through a pattern of family abuse over the past months or year or whatever the case, it's going to go up a notch. So be very mindful of this. I think this is crucially important. Sorry, that was a very roundabout way of talking.
Well, I'm curious, Pam.
Yes.
I'm wondering if the heart of Leanne's question seemed to be around documentation and medical records. And
Yes.
Are there like HIPAA compliant online sources where you could keep all their medical records private within HIPAA compliance?
I think check into HIPAA. I'm sure HIPAA is being flexible and has updated in terms of the virus. But do you mean to be, well, the thing is that your records of patients are all on your computer, and presumably you have them in a private file. They're not just sort of lumped in with everybody else's emails and so on.
Right.
And I think the important thing is check into HIPAA. But I think as long as you create a private file for new clients or a continuing file for existing clients, I think you should be pretty safe. I know a lot of hacking has gone on. So I think what I would do in a case like that might be to print out everything that I get online, so that I have a backup, and create private files as far as you can that are protected. Or if you feel safe putting things into cloud, that's another suggestion.
Okay. Great.
But as far as, yes, and keep meticulous records, because things are going to change and you are going to be addressing a whole bunch of new challenges and dilemmas in your clients, both existing clients and also new people that are bouncing into your radar. Does that help? But I'd also double check with HIPAA and find out if they're keeping up to date. You know, a lot of websites are, you know, HIPAA during the corona epidemic or pandemic, as we call it.
Yeah, good. Yeah, I think that answers Leanne's questions. Leanne, if you have further clarification, you could chime in.
Can we move on, or are there other questions?
There's one question from Nancy Webb here. I'm just going to read it out because I usually start and end each session with a guided meditation. And and often dialogue with a client on an active point. I also have
Yes.
a background in expressive therapy, so this is a big part of my session.
Excellent.
Should this be avoided at this time?
Not at all. Why would you? Why would you avoid? No, I think that's absolutely perfect. And I think the thing is, you need to, in telehealth sessions, you also, as the practitioner, you need to be very comfortable about the way you're handling it and the way you're interacting with clients and students. Don't convey any kind of nervousness or uncertainty or anything. And for God's sake, remember your sense of humor. If you can be funny and compassionate and share some funny incidents from your life, I think this can also be very reassuring to clients going through some tough times. This is very important. Don't feel you have to be too kind of stiff and formal. Wear crazy clothes, wear beautiful colors. For God's sake, don't appear in white. You know, don't look too clinical, but just look very human. I think this is important. And you notice I'm talking to you from my garden. With my son hanging up in the background. S-U-N, not S-O-N. Yeah. Any other questions before we move on to the checklist?
That's it.
Great. But I love that idea of a guided meditation in the beginning. And I think make the meditation as practical and as relevant as you possibly can. I don't think this is a time to be too esoteric, but be very human and very structured in meditations and breathing, and also, you know, do the sort of Tai Chi movements and Qigong movements where you create a circle of Qi. That can be also very reassuring, and it's very easy for everybody to do. You know, even people with crippled or arthritic hands can somehow get the Qi flowing in their arms and their hands, and it's beautiful to share and beautiful to watch. So be simple, be funny, and be very, very clear in your instructions on both online, both verbally and also visually. Any comments or questions about that before we move on to the checklist for reopening?
Wayne had a comment to keep in mind the environment of your telesession client.
Oh.
Checking in with them often to make sure that they feel comfortable.
Oh, that's good. And, you know, if they have a screaming baby in the background or something like that, don't make them feel uncomfortable about it. You know, they can also swan in and swan out. Or what I'm advising teachers to do if they're demonstrating a point or a meridian stretch or something, if there's a restless kid or a pet in the background scratching itself or whatever, involve them in it and work on them. You know, because first of all, it gives them the practice time, and also it can absorb some of that restless energy that's going on in the house or in the apartment. So I'm all for involving pets and children and birds and dogs and tortoises and whatever living creature happens to be in the room at the same time. I think it's absolutely great, and it means that those touch skills are getting refined and getting a whole new sensation, which is those of us who are teaching hands-on classes. It's crucially important for those skills to be maintained and enhanced through the telesessions and teleschools.
Great.
Okay, so checklist for reopening, and as I say, these are points that I gleaned from a very useful NCC-AOM town hall a couple of weeks ago, and so on. And of course, I mean, the important thing is, first of all, to have a look at your clinic room or your clinic practice, and remove as many sort of unnecessary textiles as possible, because woven surfaces apparently just kind of absorb droplets. So be as stark as you possibly can. There was a question about carpeting on the floors, and you know, have the carpet laundered or dry cleaned or whatever is important. Ideally, it's helpful if the floor can be washed every day or after every session. That's very important. And all your surfaces need to be sanitized, and that includes doorknobs, rails in the restrooms, you know, anything that anybody touches on their way into your clinic and on their way out of the clinic needs to be very carefully sanitized. And have hand sanitizers or those sanitizing cloths at the entrance to your clinic, entrance and exit to the clinic, and also, of course, in the restrooms as well. And encourage people just to do this automatically. As far as acupuncturists are being advised to wear both face masks, the surgical face mask, and gloves when they're working. And I've heard a lot of my ABT colleagues saying, oh my God, I cannot practice with gloves. So, deep breath here, because what you don't want is to expose yourself or expose your patient to any unnecessary contamination. So this is a hard one. I do remember a time in New York when I came down with poison ivy, and I would work with gloves. And my patients, in fact, were very amused by this, and it all worked well, but it is a challenge. And of course, what I would say is avoid working on bare skin on the neck, face, and the head at this particular time if you are working with gloves, because it can be very uncomfortable. And, you know, vary your session, do a lot of stretching, a lot of movement, integrate all your Qigong and everything. Do everything where you feel comfortable being gloved and masked. And ideally, the client should be gloved and masked as well. And so that's just another point. Have extra gloves and masks in your clinic or treatment rooms in case people forget. Now then, another thing, ask your client to chime in with you 12 to 24 hours before the session, just in case they're suddenly worried about a cough, a loss of smell, loss of sensation, loss of cognitive skills, loss of balance. Or in one case I heard about a client had extreme diarrhea, didn't think had anything to do with the virus, but in fact, it was a symptom. It's just not one of those that is publicized so much. So make sure between 12 and 24 hours of them seeing you that they're not coming down with symptoms. And of course, if they are, they need to call their PCP or call their local hotline and take advice on the nearest center to go for checking, or whatever the case may be in your particular hometown or village or wherever. This is very, very important that you have all those resources at your fingertips. Do not expose yourself. Do not say, oh, well, I'm sure tomorrow you're going to be fine. And, you know, you're probably just sneezing because of allergies or something like that. Don't risk yourself and your families in a situation like this. And also, schedule your clients far apart. They shouldn't be bumping into one another. In fact, we're advised to close waiting rooms if you have them. Ask your clients to wait in the parking lot and text you, or you text them when you're ready to see them. They come sashaying into your open door then. Don't have clients kind of bumping into one another in parking lots or anywhere else. So space them out. Now, of course, some clients who are not all that physically agile have a caregiver or a member of the family that comes with them. And that's absolutely fine. The caregiver or the family member also needs to be masked in gloves and follow all the same procedures of protective gear and hand washing and so on. And what is advised is either they wait in the parking lot, but if that's not possible, if they need to help the client get into the treatment room, onto the mat or onto the table, that they remain in the treatment room with them, that they don't come and go. This is very important. And of course, you have to, it's good to, as I said before, do the intake online or in a phone call beforehand so that you're right up to speed with what's going on with them, and also that they can pay you online. avoid a lot of contact with credit card machines or cash and so on. That's an unnecessary item that you can avoid by getting them to pay online, or do it through PayPal, or whatever system you already have. Can we have the next, let me see, the next slide? Oh yes, and I mentioned this before, remove unnecessary decorations, especially if you have, you know, a beautiful tapestry wall hanging or a textile wall hanging or anything like that. And soft surfaces, if necessary, I hate to have to say it, put plastic covers down on chairs that you know, have textiles on them, or beautiful woven rugs, or all the rest of it. You need to minimize those kind of surfaces. And also, you know, supplies are in short supply. We all know that. So tap into your local community. We have a wonderfully active Nextdoor list here, and I've seen people sort of reaching out for masks, and there are all kinds of people in our community making an assortment of masks, the 95s and also just the surgical masks, and everybody's donating material and so on. So the important thing is, if you can't get your supplies from a regular supplier, post something on Facebook if you're on FB, or your local Nextdoor. Hey, I need spray bottles. I need a local distillery to give me some pure alcohol for spraying. Don't be shy at this stage to reach out. I think this is very important, because both you and your clients really need to be protected at this time. We don't know how long this is going to go on. And also just check your local. I know some people are working under the radar, and I'm sure they're following all these rules and regulations, and others are subject to either acupuncture or MT regulations in their state about when to open and so on, and with those whole list of CDC recommendations. But what I've given you really, I culled from what the NCCAOM and put out during this town hall for acupuncturists, but it applies equally for people practicing ABT or any form of body therapy as well. Sorry, that was just my cat jumping. Okay, at this stage, let's throw the floor open for questions or comments or anything that I may have forgotten or overlooked.
Yeah, just checking the chat here. Deborah Smith chimes in with, if you're concerned about liability insurance.
Good point.
Apparently they include telemedicine under their normal coverage as long as you're doing what is described in your policy. Perfect. And Sue Cosino is asking, may I ask when the moment is right regarding this checklist? Is AOBTA making a unified recommendation that it is safe to resume practice now with these items in place?
I think the thing is, it's important to check your local county, city, and state requirements.
Right.
I don't think, is Cindy online? But I don't think the AOBTA or Devious, you can advise on this. I don't think, have you put out any kind of statement, Devious, or are you planning to? Or are you asking people to check in with their state, city, and county regulations?
I answered that in the chat. Actually, we're not recommending anything. This is meant to be a guideline for those people who feel like they're ready to resume, given the situation in their local area and their level of comfort with doing that. We do not advise anybody to open their practice if they're not feeling safe or comfortable.
Okay, that's a very good point. That's a very good point. Does that answer the liability question? And I'm assuming everybody has professional liability, either through the AOBTA or AMTA.
Yeah, we've gotten a couple of people who've sent us quotes from their insurance company saying that the insurance companies are adapting to the idea of telemedicine. And as long as your practice is, you know, your telemedicine practice is recognizable, you know, as what you do normally, it's covered.
It's covered. And I would recommend avoiding the term telemedicine, because you can run into sort of legal issues here, call it telehealth or telesessions.
That's just the term they use in the insurance. Yeah.
There is a question about regarding liability. Is there anything that clients can sign that would legally protect us from any accusations of exposure?
Devious, I would say check with your insurance company. I know that an acupuncture colleague of mine asked about this, and I drafted something very simple about the fact that, for example, a client can't sue you if they leave your practice and a week later are suddenly developing symptoms and so on, that they can't sue you. And I would check with the, I think you probably, I would personally feel very comfortable. I am semi-retired, so but if I had a whole bunch of clients waiting, I think I would be very comfortable asking them to sign a release form on this. But Devious, I'd welcome your thoughts on this, and also Matthews and Wayne's.
Yeah, I agree, but I think this is one of the nightmares of opening practice again, and I think we're probably all concerned about making that decision. You know, when is it really safe? And you know, I've read a couple articles on that, and apparently people aren't that concerned about it because it's not that easy to prove that you contracted it from a particular time and place. You know, unless they get a lot better with the tracking. But I think that it's a good idea, you know, to have that statement in place, you know, and it's part of what goes into the decision about, you know, when you feel comfortable and safe to practice.
Yeah, I think that's excellent advice, Devious. That is really excellent advice, because how does anybody prove? And that's why I think it's also very important to minimize contacts between clients that are coming to you. You know, have a two-hour window or longer, and that also gives you time to do the sanitization between clients and also change your scrubs. I know a lot of hospital people are wearing disposable scrubs, and you could probably get a set from a local scrub store. I don't know how much they cost, but I think everybody would feel very safe in disposable scrubs, unless you just have a whole bunch of scrubs or clothes that you toss into the laundry as soon as you've worked on somebody. And obviously the basics, sheets and attire or scrubs need to be changed for every patient. Absolutely. And face papers or whatever you have, you know, under the client's head, or face cradles and so on. A lot of people are using paper, and not the most comfortable, but at the same time, probably, you know, just notch up your disposables, and have sealed containers for everything, for hand wipes and things that you toss away and so on. Very important to have sealed containers, you know, with one of those swing lids. Very important. I'm sure everything that you acquire and purchase and order is all tax offsettable as a professional cost at this time. So try not to skimp if you possibly can. It's not worth a life.
Pam, somebody mentioned that they said, I don't think the virus can be contracted through the skin. Sorry, the chat has moved here. Can't immediately washing your hands before and after treatment suffice. I think it's important to realize that the reason you wear face masks is so that you don't touch your hand that has touched the virus and get it into your nose and mouth. You know, so it's very difficult to monitor that, you know, and I think that that's why it's so important to be very careful about washing hands, but also to, you know, whenever you're touching somebody, if you touch them and you've touched the virus and they touch the virus and then touch their face, you know, it's not directly through the skin, but it can be through the chain of touch.
Right. No, that's very, very important. I'm afraid I'm having a problem with people who won't wear masks. I mean, I take mine everywhere, even when I'm cycling or walking. and you'll notice a lot of people are cycling and walking masked. I think as long as you have access to a mask that you can sort of whip on if you're close to somebody, or pull up at the stop street next to another cyclist or anything like that. I just I think it's just very important to be mindful of your own health and also the health of those around you. Very, very important.
Matthew, you want the comment from, I'm not sure the name, it just is from Karen maybe.
Yeah, well, there's a couple of different comments here. That was we kind of covered. We've got Leanne concerned that she's working in an office with other practitioners, and so it's all very difficult, and emailing colleagues about protocols. And then Carlo Berger checked in about one, considering practicing on a very limited basis outdoors, since COVID-19 is much less transmissible outdoors, apparently. And then he goes on to say that the Federation and State Massage Therapy Boards, FSMTB, has helpful and detailed COVID-19 guidelines for body workers.
Yes, excellent.
They don't advocate glove wearing.
They don't have what, Matthew? I didn't catch that.
Apparently they don't advocate glove wearing.
Well, that was advocated by the NCCAOM for diplomates, and I think again, use caution, tact, and whatever makes you feel comfortable.
And Carlo also suggested, as an ethical test for those planning to reopen, go receive ABT at the practice of a colleague that you trust.
Good point.
And then if you're not personally comfortable receiving ABT at a safely run practice that is following proper protocols, then perhaps you're not ready to give ABT to others.
Yeah, I think that's an excellent, excellent suggestion. And thank you very much. I think it's perfect. Another suggestion that I think is really good is outdoor sessions.
Right.
Chair sessions in a beautiful setting, a garden, if you have one, or the client's garden, or somewhere really rejuvenating and absolutely beautiful. And especially now as the weather is getting better, I think it's a wonderful idea. And there's less contamination outdoors, especially if there's a nice wind going and so on. Just be very careful about, having a covering on your chair, or on your, if you have one of those special fold-up chairs, that you do have protective coverings on it that you can dispose of, paper coverings or whatever the case may be. But I love the idea, and also a lot of chair work out of doors as well. Mm-hmm. I think it is a splendid idea if you can do it. And, if you need to do it in a public place, but the trouble is you're going to attract a lot of onlookers.
There aren't too many onlookers on the street right now.
No, there aren't. But the trouble is
they're all hiding.
The chi creates a kind of its own magnet, and suddenly
That's
people
true.
appear from nowhere, and dogs come up and whimper and so on. I mean, it's very sweet, but maybe not the best.
There's another comment here from Sue Cosino that's, I think, important.
Hi, Sue.
She's saying, is or might AOBTA be trying to make criteria for when it is ethical or safe to see clients in person, as opposed to practitioner decisions? I'm concerned about using feelings about safe practice as opposed to clear criteria.
I think, again, Devious, because this is a question for AOBTA. Do you want to chime in here? I think Devious has been very wise in her approach to this. And again,
I don't think that AOBTA can set the criteria for you. I think I live in New York State, and I will not be opening my practice until the very strict guidelines are met for opening the localities. That's my personal opinion. And I think that it's very different if you live in a state like Wyoming where there are 10 cases. You may have a very different approach. And I think there's no way that we can give you guidelines for how to, as Pam has,
right.
We're going to open, but I'm afraid that decision is pretty much up to you and your situation.
And then Cindy mentions the CDC has clear guidelines.
Yeah.
which could be referenced.
And I think for body work, again, the FSMTB guidelines are good. The NCCAOM guidelines are very good. And as Matthew said, the CDC. And if necessary, find out what's going on in your particular city or state. I mean, here in Texas is very interesting. We've got a wonderful local mayor, and he's totally opposed to a lot of what the governor has said people can do and not do, like opening up of bars and barbershops and all the rest of it. You know, so I think the thing is, see what your particular city is doing, and only do what you feel comfortable doing, and just maximize the gift of telehealth and what you're able to achieve and what your client is able to achieve through your telehealth and these wonderful sounding Qigong sessions that everybody's doing, because I think all of that will continue, and probably you'll reach a stage where you may work on a couple of people a week that you feel comfortable working on, but the rest of the time the tele sessions and the Qigong sessions and the group sessions will in fact continue. What would worry me is if your own financial status is getting more and more compromised because of this. And I know a lot of people are looking for, you know, delivery jobs and all the rest of it to help supplement a family income, but don't rush back into practice because you need to pay the utility bill. We've all been there. But I think the thing is, use tremendous caution and wisdom. But Devious makes a very good point that the AOBTA cannot voice a list of criteria at this stage. It very much depends on your mayor, your state, your city, and hopefully an enlightened governor. Hopefully.
Very good. These very good tips that people have put into the chat. I think that it's really, there are authorities, you know, who know about this virus that we really need to pay attention to. And the financial thing, if you're going to open, Pam's given you some very, very good, you know, guidelines for how to do it as safely as possible. You know. Pam, we're about a couple minutes out from.
Okay. Well, the next slide just gives some useful links, but everybody will have those anyway. And I just sort of scratched out a few that people are using at the moment. I think it would be wonderful. Like this afternoon, I'm going to join a Zoom of an acupuncture, one of the acupuncture teachers here at AOBTA, just to see how he's doing it and how the students are reacting. I think it's great if we can bounce into one another's Zooms from time to time. Yeah. So let's be generous and have an open door here.
Yeah,
anyway.
I'm also that we could make the chat. Wayne, is it possible for us to post the chat in the same place that we post the PDF for the course, so people can see these great suggestions from people?
I'll try to make that happen.
Okay, great.
Perfect.
Yeah, and the one thing I want to really point out here is, if you haven't seen it yet, AOBTA created the wellness community on the website. And there is a pretty robust collection of all kinds of resources there. Resources about, you know, from the CDC about currently what their thinking is about practices. And also self-care resources that you can refer your clients to. It's, you know, if you go to the homepage on the website, the link is there. You can take a look through this whole collection. There is a lot there. And a lot of it having to do with what we've been talking about today.
Yeah,
excellent.
And please contribute. Please, you know, it's open for, you know, contribution from everybody. So please contribute material.
Yes, please do. Please air and share as widely as you possibly can.
Yeah. So I wanted to wrap up, and thank you so much, Pam, for putting this together.
Well, namaste, everybody.
And for your humorous ways of making this an interesting topic. I just wanted to remind everybody that Pam will be presenting at the AOBTA convention in 2021, which hopefully will be in person. We're crossing our fingers. And I also wanted to thank Brian Scow, who is our communications consultant, and Wayne Milan, who's our managing director,
Yes,
for helping us to get this thing put together. So I think that's it. Anything else from you, Pam?
No, just to thank everybody for being so generous with comments and tips and questions and everything. It's been wonderfully interactive. And again, thank you, Devious, thank you, Wayne, thank you, Matthew, and thank you, Brian, for putting this wonderful package together. And I just hope it's been useful. And feel free to get in touch with me if you have any follow-up questions at all.
Great.
I can be reached on the AOBTA website. Lots of love, everybody. Work with love and humor.
Yes.
Thank you, Pam.
Thank you.
And just so
Thank
everybody
you,
knows,
Pam.
when you sign out today, a survey about the event here will be popping up on your screen. So if you can please take a minute to complete that, we'd appreciate it.
Great. Thank you.
Bye-bye.
Do I stay on or do I click off?